Good afternoon, everyone, and welcome to our webinar on HIPAA compliant communications, focusing on email and text messaging. My name is Kathy Bryant, and I'm the manager of TMLT's Cyber Consulting Services. Joining me today as a co-presenter is Cassie Turner, Senior Risk Management Representative in TMLT's Risk Management Department. We have no commercial affiliations or interests to disclose, as do the planners and presenters and reviewers as well. A couple of things before we get started with the webinar. If you would like a copy of today's presentation, it is downloadable in the Files presentation. You simply hover over the name and there should be a downward pointing arrow. Click on that arrow and it will download for you. Also, at any time during the presentation, you may type a question in the Q&A pod in the lower left-hand corner. And lastly, we do have a poll open for just another minute or so before we get started with the presentation, and we'd love your feedback on your policy on emailing patient information. We hope you enjoyed the presentation today, and at the end of the program we would like you to be able to explain the role of HIPAA in communications, especially with patients, discuss how to ensure that your electronic communications are HIPAA compliant, and lastly, how to think about and review your current tools and methods of communication.
So as we get started, let's just take a look at some of the data that's come out from June and 2021, this past year, of the causes of healthcare data breaches. As of right now, there were 58 breaches that occurred in a hacking or IT incident. You'll see on the chart that there were other incidents as well. It's kind of a flip from what we used to see back in the early days, where improper disposal or loss and theft were really the drivers of the breaches, but now it's become more hacking and IT incident related. And in June alone, there were about 1.2 million records that were either exposed or compromised in some way. We will look here at where these are actually occurring, and you will see that a lot of the breaches are occurring around email. In fact, about 40% or 45% in 2020 where the location was an email that was the source of the breach data. That's quite a difference from back into 2012, when this data was starting to be collected. About 4% were driving the breaches in the form of email. So you can see a significant increase in hacking and especially around email, which is why we were hopeful that this topic would be meaningful to you guys today. So of the 42 that you see there, network server, the 19 that I mentioned, their email, a lot of those were around phishing incidents, so we'll talk a little bit more about phishing as we go through the program. And also just keep in mind that sometimes, even though it's identified as a network server, that attack could have been a phishing attack as well, that put a ransomware on a server. So again, we'll talk a little bit more about that in detail as we go along. So what does HIPAA say about email communication? The privacy and security rule does address email and states that when you're going to use email to share PHI, that reasonable safeguards are in place. So there's not a one mold fits all prescriptive that you can just put into place. They make this flexible so that you can choose what works best for your practice and your clinic, but they give you some parameters and some guidelines that you should consider when developing your security measures. If you're not really sure where you should start, if you've never had a risk assessment, sometimes that's a good place to start in identifying where your risk and vulnerabilities are at. That way you can develop a plan and go from there and address those and develop some good guidelines around email communications. If you have had a risk assessment but haven't really looked at it, then that might be a place for you to start as well. Just pull it out and look and see where your vulnerabilities or threats were identified around some of the things that we're going to talk about today. And then you can develop a plan and some action to ensure that you have really solid, secure email that would be quote unquote HIPAA compliant, if you will. So, does HIPAA privacy rule permit you to use email to discuss health issues and treat patients? The short answer is yes. But as I mentioned, there must be reasonable safeguards in place so that you're meeting the requirements of the privacy rule and the security rule. So a couple of examples of that would be if you're sending out an email that you check the email address, that it's the accurate email and that it's not being sent to the wrong individual. I've seen this happen. Actually, I was talking with other clinics who do this. They'll send out an email to the patient as a confirmation, hey, you want this email, please confirm with your information, your PHI in it. And so that's another way that you could have a reasonable safeguard in place, and always minimum necessary, only sharing what is required for that particular email transaction. Security rules that you will want to address, they're listed here, and we'll just discuss a few of them at a high level just to give you an idea of what you should be looking at from a guideline perspective. So the security rule wants you to look at access controls. Who gets email? Does everyone in your clinic need an email account? How are you terminating access to email and establishing access to email? Does everyone have their own unique user email, password, etc.? So from an access perspective, what are you doing to control and safeguard there? Another area is called audit controls. What are you doing to monitor and record and make sure that email is being used appropriate? Login attempts are not out of the ordinary at unusual days or times of day, rather, multiple attempts and those types of things. Integrity controls, making sure that nothing is altered or tampered with. Another piece that's a bigger piece that applies primarily to email is transmission security. How are you protecting against unauthorized access as this data is being transferred or transmissioned over the internet or over the network? Is it encrypted? Is it reasonable to encrypt the data? So those are just some questions that you can ask yourself as you're developing or looking at if your email is compliant or secure. So types of email to consider. This is the first thing, is identifying where is the email that you're using if you are using email. Are you communicating with patients outside of your network, or is it only in-office communication? Are you emailing between providers or other healthcare entities or other covered entities? Or are you using your email for personal purposes as well? So these are things to consider as you're looking at what you may need to ensure that the safeguards are in place. As you all know, email is created from your sender, and then it goes to your server, then it goes to the server of the individual that you're sending the email to, and then it goes to the device that they are downloading the information from. And copies of this are stored on each of these machines, and it may cross over the internet multiple times, which is why it's vulnerable with all of the movement of the data. So that's something you'll want to make sure that you're looking at. And as a general rule, internet-based email that's free, Google, Gmail, Yahoo, Hotmail, AOL, generally do not have secure transmission protocols in place and likely wouldn't meet the security HIPAA rules because you're often not going to be able to establish access controls, etc. A couple of things that you can look at are some of the business plans where you can sign on and get more security and more access to be able to control the measures that you have in place. Also, if you have a website, you can work with your IT or your MSP to create a domain email to work with that. Again, just different ways that you can prevent the information that's traveling across the networks from being hacked per se. We have seen in 2012, we saw a cardiac surgery center that paid over $100,000 for not taking steps to protect their data on an internet-based email and a calendar service. So we have seen some fines for this email and other things. And what if you have a disclaimer? We get this question often stating, well, if I have a disclaimer in my email that says that this information may not be protected, that's great. However, it's not going to prevent you from having to adhere to the security, privacy, and security rules. So you're still going to want to make your best efforts and put in those reasonable safeguards that we're going to be talking about. So once you've determined your types of email, the technical considerations, which we've kind of hinted at already, are your data at rest and your transmission and your email servers and how those are configured. So how are you restricting the access and monitoring that the PHI is being communicated appropriately at rest and during transmission? And while it may seem very straightforward when you set up your email server and your configuration, it's wise to make sure that that is done correctly, and assessing if there are open network ports or any points of entry where hackers could get in from something that wasn't closed appropriately whenever you are setting up these email servers to secure your email. A few other considerations for HIPAA compliant email. We saw in the poll that about 56% of you are currently using encryption, and encryption just makes the data unreadable at rest and at transmission, which we were talking about, for anything that's going outside of your firewall, outside of your network. So while passwords are still very critical, and we will always be very much highlighting having strong passwords, changing those passwords on a routine basis. The standard is still around 90 days to change those passwords, but it's also a single point of failure just to have only one password. And so now what we're seeing more is that multi-factor authentication that's being used by many healthcare entities, and for you've all have experienced these, I'm sure, with other things, banking and whatnot. So instead of just having a password, you have a password plus another identifier, a token, a PIN, bio identifier that you use to access whatever account or information that you're trying to access. So we do see this now with email having a multi-factor authentication where another code or PIN that's unique to the user is put in so that the access is granted. And it just gives another layer of protection to that particular email account, making it a little bit more difficult to hack into. The studies are showing that your data is less likely to be compromised, and there's actually a significant increase in ability to block cyber attacks as a result of this, and also a decrease in the impact from phishing emails that can result, costing a costly breach. Again, because it's more than just one point of failure; it's multiple points at that point. So again, as I mentioned, many of you are already using encryption, and that's great. Another option to consider if you aren't already doing it is the multi-factor authentication to establish that as a protocol for your email access. Administrative or non-technical compliance considerations, training your workforce and documenting, in particular related to email, is phishing, which we've been talking about. Most of you are probably familiar with what phishing attempts are. You click on a link and then it installs a ransomware in your system, and often you're not aware that that's happened. And this is really common now. The sophistication and volume of the attacks continues to increase. And I would say if you're a smaller practice, I wouldn't assume that, oh, I'm just insulated, I'm small, I'm not really of import to any of these hackers. Actually, it could be to the contrary. Because you are smaller, they may feel like you're a little bit easier, because they may think that you don't have everything in place that you should have. And they can say, well, I'll work 4 or 5 hours today and get maybe 50 or 40 $1,000 on a small ransom from a small practice. It's just an example, but just if you're smaller, don't think, well, I'm not important because I'm small. They still are also targeting smaller groups as well. A couple of recent attacks that we've seen that have been email-based was an Ohio-based group. There was unauthorized access for about 2 months of an email, and about 156,000 patient records were impacted. Also, another example is Boston Children's Physician Group. They had an employee email that was unauthorized access, and that shut their whole system down. They had a system outage as a result of that. Both of those particular groups, as a result of this, have implemented the multi-factor authentication to their email, which I mentioned earlier, as a step to enhance their security. Again, the rules require that you have written policies and procedures, so you'll want to make sure that your policies and procedures are specifically outlining all of the measures that we're talking about and how you're protecting the data and restricting access. and that those are implemented and that your staff is aware of them. Another policy just to look at in relation to these, if you haven't done so, is your sanctions policy, making sure that if for some reason someone is willfully disregarding sending email unencrypted or unsecure, that you have a policy in place to handle that if they aren't following what you've set up as a protocol for your practice. So one question that we often get is, am I required to email medical records to a patient? We asked you guys this in the poll, and some of you said no, and you may be using a patient portal. But patients have the right to ask for you to email their information. We've seen a real highlight the past year on the OCR for patient access. We've seen a lot of enforcement for patients not getting what they want from their provider in either a timely manner or in the format that they've requested. So that's something to keep in mind. If you do get a request from a patient to email them and they say, please email me this, then you can email them the information that they're requesting. However, having said that, I would not assume that the patient knows or understands their risk. So I would recommend, or we would recommend, that you go ahead and let them know your email may not be secure, your data could be compromised potentially, you understand this risk and you're willing to assume it, and you still would like the email. And then you can just document that and move forward with sending the patient the information that they're asking for. The one thing that we really highlight is that allow the patient to initiate this process. This is what we've understood from the OCR, the Office of Civil Rights, is the way to kind of go about it, rather than having an intake form that has their email on and they just sign off and they're not really sure what they're consenting to, is let them initiate this conversation about email and how they would like that to be used. Another reason why this is a recommendation is sometimes households use one email, and so you may be emailing one individual, but another individual actually gets the information, and that would not be what the patient wanted. Again, so note the risk, get their permission, yes, get their consent, explain to them the risk, that they understand that, and that they're willing to move forward with getting email sent for their PHI. And do I need a BAA with my email vendor? Yes, you would need a BAA for your email vendor. In light of what I was mentioning earlier about the free email services, those services you're not going to be able to get a BAA with, which means they're less likely to be HIPAA compliant. So anyone that you work with, we know sometimes they may not sign your BAA, but you can get a BAA from that particular vendor, look over it and sign it and have something in place that's showing that you made an effort to get a business associate agreement with your vendor that's providing your email services to you or hosting your email servers. If you're looking for additional information on business associate agreements and how to go about that, we had a webinar last month with one of our attorneys, Adrian Sinishin, who gave a lot of great information on working through BAAs. So if that's something of interest, you can find that on our TMLT hub at your convenience.
So let's switch gears and talk about texting. I think probably most everyone on the webinar today would agree that texting is just sort of a way of life. We know that, we pick up our cell phone and we text message a quick message to family or colleagues, almost much easier than we pick up the phone and make a phone call or send an email. So we're going to talk a little bit about texting and HIPAA at this point. So we have another quick poll that we'd like you to answer. And this is just a fill in the blank in your answer spot. How many times do the words texting or text message appear in the HIPAA security rule? And you can just type in that your response very quickly. It might be interesting to know that SMS texting, which is the text messaging that most of us use, was actually invented in 1998 by a 22-year-old British engineer. It is said that the first text message he sent was to a friend and the friend's cell phone weighed more than 4 pounds. Um, you may remember those days when the cell phones could be used as a boat anchor almost. So thank you all for participating in the poll. The answer that several of you actually got correct is 0. If you think about it, the HIPAA rules were written originally, the original law was written in the late 1990s, and so HIPAA or SMS texting was just being invented. And the HIPAA security rule that was invented, or not invented, but was put into place in 2005 has never been modified. So, question we always get is texting a HIPAA violation? Quite honestly, the answer is technically no. The privacy rule and the security rules do not mention texting, as was said earlier, but they do expect us to meet those technical safeguards, much like Cassie described for email. Way back in 2018, Roger Savino, who was the director of the Office for Civil Rights, who enforces HIPAA, said at a conference that healthcare professionals may share protected health information with patients through standard SMS text messages. He went on to say that as a provider, you must provide the patients with a warning that texting is not secure and get their consent to continue to use text messaging and make sure you've documented that consent. Fast forward to today, Roger Savino is no longer the director of the Office for Civil Rights, and despite having made this same comment at multiple conferences and in multiple interviews, there is no policy guidance from the OCR. So let's take a couple of common, or a look at a couple of common examples of where texting is used in healthcare. Probably one of the most common places is call centers or answering services. They often use text messaging to send a message to a provider that a patient has called. Sometimes it goes into more detail, such as patient is called, is concerned about a certain situation. Please call them back at a phone number. That's protected health information. As just like any other business associate that you are going to be having them do something on your behalf with protected health information, like taking messages. You'll want to make sure you have a business associate agreement in place, and you need to try, if at all possible, to make sure their messaging application is secure. If it's not, you may want to look around at other options. There are situations where it's perfectly legitimate for you to text message between yourself and another provider. That would be, I'm signing off for the afternoon, have a great weekend. Absolutely nothing to be concerned about that. But if you go a step further and say, I'm signing off for the afternoon, but I'm really concerned about a certain patient in a certain room in the cardiac intensive care unit. Uh, would you check on their labs, whatever? You're sharing protected health information in an unsecure manner, perhaps. Also, you may be taking messages or texting messages or receiving messages from your staff members. They often work like an answering service if you are not in the office. And again, if they're sending protected health information, that could be an issue. So patients often are texting physicians. So you'd say, well, how did they get my cell phone number? Imagine that you're either a friend outside of your professional relationship. I go to church with a physician. I have their cell phone number. If I were their patient, what would prevent me from texting them after hours or on the weekend? We often hear about this with pediatric practices where younger physicians may have kids that are on athletic teams with their patients' parents, or the patients are also on the same athletic team. And so parents often just use that uh, cell number to send text messages that perhaps aren't appropriate. But the important point is, how do you respond to that text message? Do you answer back with a bunch of questions that then have the patient send a bunch more protected health information? You might just want to be careful. You can always just simply call the patient or the parent back and not be sending PHI over the text message. Of course, EMRs and EHRs often have secure portals or other sorts of secure messaging applications built into them, and we would always encourage you to use the most secure application possible. The issues with texting are basically about control and technical safeguards. As a sender of a text message, you have no control over the final destination of the message. You don't know if someone that is not authorized to see the protected health information may have the um, the passcode to get into someone's cell phone, or maybe it's not passcode protected at all. The other issue, much like Cassie described, is that copies of those text messages remain on the service provider's servers indefinitely. There's no way for you to go back and retract them or delete them. And so these can be security vulnerabilities. We already talked a little bit about the patient text message, or the patient's text messaging the physician. And again, it's about how do you respond. You need to have good policies and procedures on how to respond to a text message, both for providers and for staff. And make sure that if a patient is requesting text messaging as a preferred communication, that you evaluate if you can honor that. There are certain uh, populations that may prefer text messaging as their method of communication. A few years ago, we worked with a client who specialized in the hearing impaired population, and so those patients often were requesting for information to be text messaged. What we were actually um, fortunate in that the physician did find a secure messaging application that he could use for his patients. And just a little word of a reminder, the Texas Medical Board a couple of years ago did add a requirement that physicians include a summary or documentation memorializing communications transmitted or received by the physician if that information was used in medical decision making. So if a patient texts you a, a message and they say they have something going on, even if you pick up the phone and call them back and say, okay, this is what I think's going on, this is what I'm going to suggest we do, you still have to write that down in your record. It can be written as a phone note or however your EHR or your record or your messaging system, I'm sorry, not your messaging, your documentation system allows. Just like everything else with HIPAA, there are many consequences for noncompliance. I think the biggest one is navigating the maze of noncompliance. We're seeing more and more state attorneys general actually start investigations before the Office for Civil Rights when patients from other states in particular are involved in a breach of data from your practice. It's definitely going to take time away from your practice and have a financial impact on the practice. So we are just about at the wrap-up time, but we will take some questions. Um, just a couple of reminders. On the left, you can still download a copy of the presentation. We did put a free text box in. We're looking for suggestions for future webinars as we continue to plan topics for the future. And of course, we'll still be taking questions. At the end of the question and answer period, we will launch the CME evaluation that will be open in your browser. And if you have any questions that you come up with after we've closed the question and answer period, you can always email those to consulting@tmlt.org, and we will work to try to get those answered for you. So Cassie, it looks like we have a number of questions. Um, the first one is, does TMLT have best practices for small providers, such as, or small practices like 1 to 5 providers, especially concerning shared emails versus individual email addresses? I think Cassie covered the general best practices in that everyone should have an individual email. You should definitely try to get a professional email domain rather than using just Hotmail or Gmail or one of the other free accounts. You should have the ability to encrypt your emails. And if there are specifically other things that you're looking for, we'll be um, happy to share some additional resources if you want to email us at consulting@tmlt.org.
Yeah, I think I would just add on that shared email, if there's not a unique name or a way to track a particular email, that might be something to consider as a best practice for if you're sharing emails or sharing passwords for the same email login. So our next question, is there a Microsoft Exchange, and is it considered HIPAA compliant, Microsoft Exchange? If it's the professional version, again, as Kathy mentioned just now, you still want to make sure that encryption is in place and that everything has been set up correctly. Microsoft will offer you a BAA, but that does not necessarily mean all of your internal processes are compliant with the technical safeguards. So you would still want to ensure that all the technical safeguards are in place, and that there's a form of encryption at the data at rest and at transmission. But the Microsoft Exchange email, if it's the professional one, as we mentioned with some others, is a better option than a free internet-based one.
The next question is, how do you encrypt email? That is very specific to the email service that you are using, whether it's a Microsoft Exchange Outlook email, or a number of other email service providers that are out there. I would suggest that you talk with your IT person as well as whoever set up your email and make sure that you have the ability to encrypt. And this would be a great learning opportunity if you have an example, or if you have um, a training on with your staff on how to use that. And as Cassie mentioned, as much as the individual emails is important, especially if your staff are accessing their work emails on a cell phone or a personal device, multi-factor authentication becomes very important. Again, you don't want their kids or whomever picking up their cell phone and reading work-related emails.
So, next question, can you send us written policies and procedures? If we do have templates that are available that for purchase, if you want to email us at theconsulting@tmlt.org, we can send you some additional information about policies and procedures. What the HIPAA privacy and security rule requires is rather robust. So if you don't have anything in place and are looking for some options, we can share those, or we can point you into some other places where you can find other templates that are available. There's lots of examples out on the internet as well.
The next question has to do with emailing medical records. Can you have a policy in place that says you do not email medical records, that you would just put it in the mail to them? This again gets back to the individual's right to access their medical records in the form and format that they request. The OCR has fined, I want to say it's 20 or 21 medical covered entities in the last 18 months for failing to provide those medical records in the form and format that the patient requested. So I would really caution you against saying absolutely no. If you have the ability, if you have the technology to make sure that you can email the patient or suggest a viable option. Maybe you can push out their requests through your patient portal. You should always look for the most secure option that works, but not to forget that the individual's rights to the individual's rights to access their medical records, again, in the form and format they request, is a huge emphasis of the Office for Civil Rights right now.
So what do I do if a patient contacts you through social media like Facebook or Instagram? Um, I think that our general recommendation is not to respond to Facebook or social media platforms. Kathy, feel free to elaborate if you have anything more. Those are definitely not HIPAA compliant. Again, it does seem as though the patient maybe is implying consent, but again, generally we recommend not responding to
So
those.
yes, I certainly agree with Cassie. Generally, we recommend you either respond in something very generic and the same thing every time, like uh, we appreciate your feedback. You can please contact us, please contact the office to discuss this further. But no, I would not recommend, messaging back with whatever social media application. Um, see, we're looking for vendors for an SRA. Any suggestions? Um, we can email you some suggestions after the program. Again, if you would send that question to consulting@tmlt.org, we'll be happy to share some information with you.
So can you email an encrypted PDF to a medical records company such as EMSI, Exam One, etc., from an unencrypted email? Can you email? to I'm not checking quite with the question. I would say that you would want to make sure that if your email at rest on your system is encrypted and then through the transmission process that it is encrypted, if the email for the recipient, and I see this question on another side, in particular for a patient, if they understand that they have a risk, particularly the patient, that their side is not encrypted, that they understand that and they're still willing to move forward, I would say that would be something you want to document. With the case of another medical records company, you would want to have a BAA in place and you would want to know what they have in place on their end if they do have encryption or if they're receiving things on their server and that their server is encrypted. I would hope that it would be if it's another covered entity, but definitely something to look at it from a BAA perspective as well as when you're setting up a business with that particular company. And I'm hoping that that answered your question.
The only thing I would add to that would be that yes, you can encrypt a document, uh, but then how are you going to share how that document must be unencrypted? How are you going to share that decryption key uh, with whoever you're sending it to? So again, it's just a matter of thinking through the process and making sure that every step in that process is actually meeting the HIPAA requirements. The next question is about the main points that should be included in a business associate agreement. If you have not gotten a business associate agreement in place with all of your business associates, would certainly recommend that you do that. The BAA is a very specific document. The OCR has, or the HIPAA rules actually have a lot of requirements for that, probably more than we have time to go through right now. Is there a, if you can either Google HHS or OCR sample business associate agreement, or if you want to email us, we can send you a sample BAA that covers all the points.
So with pandemic, we're seeing less patients in person. How do we balance convenience over security? Really tough scenario that we find ourselves in, which is also what the hackers have seen, and that's why we've seen a spike over the pandemic in some of these ransomware attacks. I think, again, making your best effort to ensure that patients understand, particularly with email or texting, they understand their risk, that you're documenting that you've discussed that risk with them, and then doing the best that you can on your end to ensure that, simple, well, they seem simple, but having encryption or having a professional email server or provider, while maybe a little bit more expensive, it would give me a little bit more certainty perhaps that things are a little bit more secure versus just a free internet-based email or just text messaging outside of maybe your EMR or your portal. That's something we didn't really highlight a lot, but using your patient portal is another good way to keep things secure without using email or text when possible.
So the next question has to do with uh, appointment information that can be sent to patients via text messaging or call, medication adherence requests. Or I think that's can medication adherence requests be sent via text message. Um, I think patient information text or as far as patient information, again, you should really limit the protected health information. If you're going to send a reminder that, Kathy, you have an appointment with the medical center tomorrow at 9 a.m., That's probably okay as long as the patient has not told you they don't want to be communicated with via text message. But if you are getting into medication adherence requests, again, you're going to really want to look at the security that you're using with those messaging applications. And is there a way to do that? Can you have your portal set up to send a patient reminder to the uh, to the patient via portal, even if it sends them a text message that says you have a new message in your portal?
So suggestions on services that are HIPAA compliant. Again, if you have a website, setting up a email domain would be a good place to start, or some of the professional packages that are available through some of the providers that offer those. Again, it's just keeping in mind that your internal process also needs to have the safeguards in place to ensure that it is all actually HIPAA compliant.
And additionally, there are new security requirements, or not security requirements, but security features with email. So if 5 years ago you had a company set up a professional email domain for you, those cybersecurity factors may not have even been around then. So I would suggest that at least once a year you revisit with your email provider and say, are there new security features that I should be turning on? How do I encrypt emails? Whatever. Again, that's just part of staying current with technology. So the next question says that for the most part, we do not allow texting or emailing, but if a patient texts you and starts the conversation, what is the best practice before replying? I think you can send a generic response is, thanks for your question. Uh, my office will be calling you, or simply not respond and just have, place a phone call or a secure message through the portal. These become tricky, because unless the patient says, no, I want you to only text message me, then that can be difficult. And a similar question was related to a patient that wants to text instead of calling the office. And the question was, can I text her to cease and desist texting during business hours? I think you need to look at your overall policy and procedure about texting. Why is this patient texting versus calling the office? And is this a special request for a form of communication before you just simply state no? You should not actually help out with with additional information. Um, there may be exceptions to texting. There's exceptions to everything, unfortunately, but I would just be very careful before you just tell her you will not text with her. Um,
Next question, what do you suggest for being compliant with text messaging? Are there any apps you recommend? Patients are demanding it. EMR companies seem to be lagging on meeting patient needs. There are some text messaging apps that do exist. There are some EMRs do have that integrate with the EMR system, just depending what EMR you're using. Again, the same information that Kathy shared on texting, the safeguards that need to be in place, ensuring that your devices have some form of passwords on them, so that there's some layer of protection on those devices. And I always just like to mention too with Apple devices, if you're at home and that device is communicating with your laptop or your iPad or your Apple Mac, just ensuring that all of those places are secure, or if they're talking to one another, just being aware that there are other places where this information may be being saved.
Couple of questions about, does TMLT have any particular email provider that they suggest? No, we do not. Obviously, you need to have someone that can support your email, whether that is, a local provider or someone that can support you remotely. Um, so I would just be careful, um, uh, and vet the provider. Maybe talk with some of your colleagues to see who they have used and if they're satisfied with a certain email provider.
If my email is secure but patient's email is not, again, just getting their consent, letting them know the risk that they are exposing themselves to, and documenting that they understand their risk, and keeping that as, due diligence on your side.
If you do text messaging about patients with your staff and delete it at the end of the day, is that okay? The problem with text messaging, much like email, is that you have no control over where copies of that message are stored. First of all, if you're texting with staff, how do you assure that they're deleting their messages at the end of the day? Even if you do, that doesn't delete it on their end. Plus, there are copies that are throughout the system. Every different server that text message hits between point A and point B uh, saves a copy. So that is probably not the best practice, um, but most of the EHRs have a messaging system within the EHR, and that might be a better option to look at.
So if a non-patient requests medical records via email, such as lawyer, insurance companies, doctors, or courts, must we comply with their request? This one just gets into a lot of other issues that for email, again, I would, before emailing anything, I would also check with the patient and ensure that you're authorized to share this information. Each of these categories is a little bit different, particularly if it's a court order, if it's a subpoena, then you may be required to follow whatever they're asking of you. With a doctor's office, it may be a little bit different. So a variety, if you have a specific one that's really giving you some grief or whatnot, please just email us and we'll provide you a little bit more direction. But it would depend on what each of those, again, court order would be the one that may have some requirement that you would have to follow, particularly under a subpoena.
Yes, and I would just add, patients have special privileges because under HIPAA, they have a right to request their medical records, again, in the form and format that they desire. That same right does not extend to non-patients, especially attorneys, insurance companies, and quite honestly, even other medical offices. So I would say that if you are going to be sending those types of records through email, then you need to have a way to encrypt them. If my email is secure, but patient's email is not, is it okay to send medical records? I guess you would have to determine, or I would wonder how you're making the determination the patient's email is not secure. If you are sending an email from a secure system in an encrypted manner, Once the patient opens it, it becomes their, and they're in possession of the information, then it's their choice of how they protect that information. It's not your problem anymore. Your responsibility is on your side of the emailing system, and then the protection of that content during transit.
Medical records through the patient portal count as authorization to release records. Um, I would say that that's the best way to release the records. If the patient sends a request through the portal requesting their records, then I think it's reasonable to release the records to the portal if they've requested that to be done.
I agree, especially because, patients uh, do not have to sign the same authorization that, yeah, an outside third party would. You would need to get signed by the patient for an outside third party, so I think that's reasonable. The next question is about WhatsApp, and that it has end-to-end encryption. Can we use that application? WhatsApp is an interesting application. They do have end-to-end encryption. However, the last time I checked, which I think there probably are was maybe a year ago. In order to get a business associate agreement with WhatsApp, you actually had to have an enterprise version of WhatsApp. And I believe at the time I checked, the minimum users on the enterprise version was 250. So I would want you to make sure you're asking questions of WhatsApp and getting a business associate agreement if you're going to use it. There is a question about cyber insurance and what's available on the market. Um, we'll we'll try to answer that question offline because it's really not exactly on topic.
You may have mentioned this, but is a password protected PDF document with PHI adequate when encrypted email is not available? Also sending the password in a separate email to the same party. I prefer to text or phone call of a PW separate from emailing for better security. Yeah, Kathy touched on this a bit earlier. It's how are you going to get the encryption key to the individual and assuring again that all of that is being sent securely. It's possible to do it, and I think that if you're sending it secure PDF encrypted and then sending an encrypted email with a PIN or a access code, that could be a reasonable option.
I would just add on that password protection and encryption are not the same thing. So if you are asking, can you send a password protected document through an unencrypted email, you may want to think about that because again, a password protected document is not going to offer you the same protection under HIPAA that an encrypted document would offer. My business email address is secure on a business domain. Is that enough or does it need to be encrypted? You're definitely on the right track. I would say since you obviously have gone to the effort to get a business domain, I would talk to the provider and just ask them how to add encryption so that you have that available.
So next question, is it a law considered a violation if I just text the patient name and phone number to another physician but don't include any specific health information? Actually, name and phone number are considered to be protected health information, so all of the things that we discussed would still apply, and that could potentially be a violation just with the name and the phone number.
We are at We've been taking questions for about 30 minutes. I'm going to just scroll through the remaining questions and see if there's anything that I can that um, let's see. One is I will go ahead and launch the CME so that you evaluation. It should have just popped up on your screen. You may want to minimize that until we're finished. Um, if your question did not get answered, then you're certainly welcome to email that to consulting@tmlt.org. The last question I would just answer is, are initials considered protected health information? It's initials in combination with what? Um, that's what you you would need to do. If the CME evaluation did not pop up on your screen, you can click on the CME evaluation, the green words, and that should open the link in your browser. Thanks everyone for all your questions. It's been great to interact with you today, and we certainly appreciate you all for hanging in there for the very extended question and answer period. As always, we would invite you to give us your feedback on the CME evaluation, and certainly, again, use the consulting@tmlt.org to ask questions. Thanks everyone, and have a good evening or a good rest of your day.